Thank you all for attending today's Ebola briefing. Today, Dr. Corvo and I would like to provide an update on our system readiness in the unlikely event of an Ebola case here in the Northwest Territories. To confirm and to be clear, we do not have any cases of Ebola in Canada or in the Northwest Territories at this time. Since we first learned of the outbreak in West Africa, the federal, provincial, and territorial health ministers have worked closely to ensure that we are prepared and ready in the event of an Ebola case in Canada. Yesterday, the federal, provincial, and territorial ministers of health held a teleconference to discuss the state of readiness across Canada. The federal government is taking concrete steps to ensure the safety of Canadians, and in particular with regard to Canadians and other travelers who are coming from affected countries in West Africa. All travelers coming from one of the affected countries are now being screened and assessed by the federal quarantine officer at its ports of entry. Anyone who is symptomatic will be hospitalized immediately for further investigations. Asymptomatic travelers will be ordered to report within 24 hours to the local public health authority, who will arrange for daily monitoring until the end of the 21-day incubation period. As a smaller jurisdiction, we rely on the support from our federal and provincial colleagues. I'm reassured that the Public Health Agency of Canada is working to ensure that emergency transportation will be available in the event that someone with Ebola is diagnosed in a remote location or jurisdiction like the Northwest Territories. Only very specialized aircraft and trained crew could be used for this type of transportation. It is important to note that in the event of an Ebola case in Canada, we can also count on our Memorandum of Understanding with the federal, provincial, territorial jurisdictions for the provision of mutual aid of health resources during emergency situations. This means we have the ability to work with jurisdictions on sharing materials and supplies, personnel, and expenses. The Ministers of Health have also agreed to provide access to treatment facilities for regions that are unable to treat Ebola, like the Northwest Territories. This national planning is vital to ensure that we are all ready. However, it is equally important that our healthcare professionals are prepared to handle an Ebola event here in the Northwest Territories. We must ensure that the safety of our frontline staff. The Public Health Agency of Canada is providing us with the guidance on a range of topics, like what types of personal protective equipment to use, and we are sharing this information with our health and social services authorities. The outbreak has reminded us of the importance to review our infection control practices and supplies and to rehearse our emergency infection control procedures. We have learned from our partners in the United States that practicing case scenarios is important to better ensure that the staff are ready to respond. Our nurses and frontline staff are key in our response, and we must plan with the highest regard for their personal safety. The Department is getting regular updates from all of the health and social services authorities on the status and the preparedness of each of our regions. I'm pleased to report that our 8 health and social services authorities have procedures in place and practices to ensure compliance with standards for control of infections in health care facility settings. The authorities are training staff on the principles of infection control, the use of personal protective equipment, environmental cleaning, infection control precautions, and occupational health and safety. On a weekly basis, we keep our authorities appraised of the best practices and supports from other provinces. This includes screening, assessment, and triage, clinical care guidelines, workplace health and safety, and the authorities will continue to undertake education and training and to implement policies, procedures, and practices as we continue to learn more regarding approaches to best manage this disease. The Chief Public Health Officer will also provide direct clinical guidance to frontline staff if it is needed. I would like to encourage residents to visit the Department's website as well as Public Health Agency of Canada website for the latest information. Information is being kept up to date, which is important. Everyone should consider their information sources carefully and not believe unsubstantiated stories or hype. Misinformation will not help us fight against Ebola. The chances are very slim that we will see an Ebola case in the Northwest Territories. Our best action to keep the NWT and Canada Ebola-free is to provide support to those aid organizations on the ground in West Africa. If residents want to help eradicate Ebola, organizations like the Red Cross and Doctors Without Borders have good websites where making a donation is very simple.